So welcome again. This is the midday download brought to you by CAQH. Our topic for the day is moving beyond the blame game. This is about provider directory and how we can get health plans and providers on the same page. My name is Ron Orwong. I am a product manager here at CAQH. I'm joined by my colleague. Hassan, could you introduce yourself as well?
Hi, everybody. My name is Hassan Sohail. I work with Ron, particularly on our direct serve solution, and I'm looking forward to speaking with you guys about the provider directory problems today.
Okay. So let's go through some housekeeping just in terms of how this webinar will be conducted. This session is being recorded, so you can see that there. So just be aware that you'll be able to get this information later. Your phones will be on mute, but if you want to submit a question, and please feel free to submit a question at any time. This is supposed to be really casual, and this is all about you. We want to answer your questions and know what's on your mind. But go ahead and navigate over the questions panel on the right side of the GoToWebinar desktop, and then just jot one down. We'll pick it up, answer it during the webinar, and we'll have some Q&A time afterwards as well. Okay. We'll also have some polls that are happening during the webinar, and so those will pop up in your screen and you'll be able to answer the question. We'll review the answers in real time. Okay. And if you have any other questions about just logistics or anything, feel free to chat us. We've got lots of people on the line to help answer your questions. Okay. So just a little bit of information about CAQH for those of you who may not be as familiar with us. We're a not-for-profit alliance or a leader in creating initiatives to simplify the business of healthcare. We offer a portfolio of solutions, one that many of you probably have heard of, CAQH ProView, but also Direct Assure, Verify, and Sanctions Track. Those are kind of round out or provider data solutions. We'll be focusing not necessarily on the solution, but on the topic of provider directory today, and just all the complexities of getting the right information from providers. I'm going to hand it off to my colleague, Hassan. We did ask a poll at registration, so we want to review some of those results.
Thanks, Ron. So we asked some of the registration participants to tell us what were some of the reasons why they were getting the data accuracy that they were seeing from providers around the directories problem space. So what's interesting about these results, I'm not going to go through all of them, but it seems like the highest responses were on option number 2, which is that the process is too cumbersome for providers to submit and deliver these directory data elements to all their contracted health plans. But also the last one, which providers don't seem to understand the impact that this data has for the patient. So we're actually going to talk about both of these problem spaces, why it is, and what some of the strategies that you can do on your side to improve this situation. So Ron, I want to throw it back to you to go to the next slide and really tell us why historically there has been sort of a back and forth between the providers and the health plans on submitting the correct information and not updating it and so on and so forth.
Yeah, so if I remember back to kind of the 2015, 2016 time period when the regulations started emerging from CMS in the states, even before the regulations hit, the industry was talking about the provider directory problem. You guys remember there's a health affairs study and a JAMA study on how inaccurate health plan provider directories were. Honestly, at the time, both on the provider side and on the health plan side, there was some finger pointing. And what we have here are just some thoughts and perspectives from each side of the industry. So on the provider side, they're saying, I've submitted my updates. I haven't practiced at this location month, sent the updates, but the plan just hasn't updated it yet. So there's a lot of, I'm giving you all the right information. If you just used it, your directory would be fine. And then more recently, as health plans have become more aggressive about fixing their directory issues, there's all these phone calls and faxes and requests. So they're just becoming overwhelmed. And on the health plan side, of course, there's some discussion about, well, if the providers just gave us the right information and updated us in a timely fashion, then the directories wouldn't be inaccurate. Health plans are, in fact, at least from their perspective at the time, they're saying, well, we are in fact updating their directories. And more recently, as health plans are doing some of their own audits and making phone calls are saying, well, providers are telling us different information at different times. So, as you can see, there's some disconnect here because, providers feel like they're submitting the right information and health plans feel like they're updating. So, Hassan, I wanted to get your perspective on this because I know you've talked to providers and health plans on both sides. Why do you think there's this disconnect?
So, Ron, it's interesting. I think the problem really starts with our definition of who a provider is.
Yeah.
Now, health plans generally tend to think of providers as a monolith.
Right.
But the research we've done is it's actually not, all the people that are submitting information is not one provider or a particular provider. Mm-hmm. It varies based on the context of the provider practices, right? Yeah. So what we did is we broke down these contexts into three fairly broad categories. They're displayed on the screen. So the first one is our archetype of a solo practitioner. Yeah. And we'll get into what defines the archetype. The second one is sort of a medium practice. Mm-hmm. And the third one we're going to talk about is the sort of large provider organizations. Right. And those ones are really important because they're responsible for the vast majority of deficiencies in health plan provider directory data. So let's drill down a little bit. Let's talk about the solo practitioner. So what we found in our research is in this scenario, when you have a sole practitioner or one or two people really very small providing service, the data is actually of fairly good quality. And that's because oftentimes the person who's submitting the data is usually the provider or someone very close to the provider. We actually had we experimented with some incentive campaigns, and we found that there was one provider who had really good information, and we asked them, how come your information is always up to date and very accurate? And it turns out that his wife was sort of managing this information for him, and she was making sure that all of his practice location information is up to date and always properly reported. So again, someone very close to the provider, oftentimes the provider themselves reporting that information. Now let's move to the next slide. Let's talk about some of these small practices. So this is a scenario where you have a group of practitioners working together, generally about 5 or 10. The data quality in this scenario is okay. It's not the best, but it's also not the worst. Yeah. The key difference here is you have usually one office manager who is maintaining information for these handful of providers. So you can imagine they're trying to leverage efficiencies by working together as a small practice. They're trying to consolidate administrative tasks to one person so that the providers can focus on delivering care. In this case, again, we found out that the data quality is okay, but it could be better, but it's not as bad. And it moves us to our third category, which I think is the most important. Yeah. Now we're on to the large provider organizations. So these are large groups. These are names we're familiar with. We found out that they're responsible for the vast majority of deficiencies in health plan directories. Part of the reason is the folks that are submitting that information are really far removed from the actual practitioner. So when you talk about practice locations, panel status, that information is hard for them to get to. Yeah. Not only that, we found out that the data is submitted, when the data is submitted, it's submitted by very siloed departments at these institutions. So usually in terms of job roles, you have credentialing, billing, contracting. There's no job role for directory. Right. So when we get data from these organizations, it doesn't really have that context that we're really used to, or that we expect rather for this problem space. So Ron, again, I'm going to turn it over to you to talk to us about why it's the case that some of these organizations are submitting bad quality data, especially some of the larger organizations.
Yeah, so we'll go into some of the reasons, and really, these aren't going to be a surprise to most of you guys. You've probably seen this in your interactions with providers and in your efforts to improve your own directories. But what we want to do right now is try to put ourselves in the shoes of the provider, really kind of empathize and understand where they're coming from and understand the voice of the provider, because it's important to be able to do that, because I think understanding their motivations and behavior, as we're looking to different interventions and solutions, it's important to know where they're coming from so that we can kind of prioritize the right solutions that we want to employ. So some of the contributing factors that we see, this first row here is that, we've got multiple disparate channels. So, providers are submitting data in a lot of different ways, right? They're shooting emails, they're sending faxes to the health plans, they're making phone calls, they're calling up the network representative. Sometimes a health plan has a portal, sometimes health plan is using CAQH. Now, when a health plan employs all these different channels, I know that there's the motivation is right from a health plan perspective. They want to be able to get the information wherever it's the most convenient for the provider. But, from the provider's perspective, we've heard this time and time again. Their preferences around the channels are not incredibly strong. They want the health plan to pick one and be consistent in the one that they pick. Because then the provider will know always to go to that one place to update the information. So, all that to say is that, from the voice of the provider's perspective, they're asking, why are health plans making it so difficult for me to make a simple update? Why do I have to update it in all these different places for all of these different health plans? So the second aspect here is that health plans are slow to update. I know that's changing with a lot of the regulatory requirements, because as you see with Medicare and many of the state requirements, there's this 30-day requirement. As some of you may remember, back in the early days of the regulations, I believe it was the Medicaid requirements where they're saying it's got to be real time, but the regulators have walked back from that. Right. But still, the providers, before the regs, providers had a historical experience of inaction. Like they would submit an update, and either it wasn't done in a timely fashion or wasn't done at all. So it's important to be able to be as responsive in a timely fashion as possible, so that providers have a good sense that if they're going to spend the effort to do something, it's going to happen. It's going to have an impact. So there's the incentive issue too. Providers want to submit information so that they can get their claims paid. But directory hasn't historically been associated with that. We know, and I guess I won't get ahead of ourselves here, but Hassan's going to be talking about some things that health plans are doing there. Related to that is this whole notion of preventing future claims denial. So, as many of you know, the vast majority of these deficiencies are provider not at location. So it's like 66% of all deficiencies that CMS found in health plan directories were provider not at location. Some of the driver there is that these larger groups are submitting all locations for all providers within their group, which, that's kind of has an exponential effect in terms of the number of deficiencies that those groups are generating. There are ideas that, hey, this is a real location. The provider may, and may in emphasis, may practice at this location at some point, may cover for a colleague, and so they need the health plan to have in their system. They want to prevent that rare scenario of a claims denial based on location. And then there's this whole notion of, or this idea that directory, as Hassan has said, is not there's not a titled job of the directory manager within groups. Now, we're seeing some more interest in that in the marketing departments, and we think there might be some opportunities there. But the jobs that health plans are asking providers and practices to accomplish just keep growing and growing. There's directory and credentialing, risk adjustment, quality. So these guys are just overwhelmed. So we know where they're coming from, right? So Hassan, I'll hand it off to you. I know that you've seen some health plans in terms of how they're trying to solution this based on where the providers are coming from. I'd love to hear more about that.
Yeah, so I think it's really good to have a good understanding of the problems that we're talking about as we talk about what are some of the key initiatives we can do to overcome this problem space, or at least move in the right direction. Mm-hmm. So we've highlighted a couple of elements, and I'll walk through those. So I think what can't be emphasized enough is provider education. And we saw this in our poll results in the beginning.
Right.
So I think what the industry needs to do, the health plan industry needs to do, is make sure that the provider groups understand how this data is being utilized, right, how integral it is to the member having access to care.
That's right. Yeah.
So specifically, we talked about large groups. I think it's really important to open communication channels with these large groups and strategic large groups and take the patient's perspective to at least come towards a common goal, right? So we understand that the provider organizations are already overwhelmed with the administrative burdens that they have to
Right.
But if we can align on the fact that we're all here to solve the patient's problem, make sure the patients have access to care.
Right.
There's an interest in that for the group, for the provider, and obviously for the health plan to make sure that the patient can get the care they want. And I think that's really a path forward to making sure that everyone can slowly get to alignment on the importance of this data and also submitting it accurately. One of the things we did on our side, and actually was driven by our provider community, was they wanted to know how they can report information on the CAQH ProView platform so that accurate directory updates are made for their providers and practices.
Yep.
And we worked with them, and we actually came up with a checklist, which we distributed to our provider community. There's a link here. It's posted on our website, and it was really well received by medical societies and organizations representing the provider. They finally had a document, or they finally had at least a way forward to say, if I follow these guidelines and report my information, that we know that it will be accurately captured in a directory, or at least the health plans will be looking at it correctly, right?
Yeah.
So we tackled some of the problems you were talking about earlier around, well, should I report a location just because it is part of my group? Or is the provider actually working there and taking appointments? So we've made some of those adjustments on our side and really provided some clear guidelines to our community on how to report that.
Yeah, it's really interesting because you see checklists popping up all over the healthcare industry and healthcare quality. I guess we're showing that it can be used on the administrative side as well to ensure data quality.
Exactly. The second point is more interesting. It's really around aligning incentives. So we know today the accountability of accuracy is on the health plan.
Right.
And how can they get the provider community on board? We know that some plans are starting to use economic incentives to leverage this problem.
Yeah.
We haven't seen any completed results on that yet, but we hope that more experiments in this problem will continue, and the plans will continue to use incentives within contracts that they have with providers to ensure that they're submitting accurate information and that they share sort of the responsibility to make sure that this data is accurate and actionable.
Right, right.
The last point is, I think, the most important, and this directly touches with the survey results we saw in the beginning, which is that we as an industry do need to meet the provider community where they're at today. What this means is that we need to tap into their workflows that they're using. We should not, I repeat, should not add another thing that they have to do on their plate.
Right.
We should tap into whatever workflows that they're using so that sharing of directory information can be easy and can be widespread. And on top of that, health plans need to respond and be responsive to the updates that the providers are making through these workflows.
Yeah.
So I think those two things are really critical. I already mentioned that we need to avoid methods where we add additional work. That's just going to alienate the providers even further.
Yeah.
So really, again, need to meet them where they're at, make the job easy for them. One thing that we did on our side at CAQH was, while we were developing our provider directory solution, we had the provider's interest key in mind. So we layered our solution on top of our existing ProView workflow. So we know that the providers are already coming into the system. They're familiar with it. And we just layered a directory workflow on top of that. So it's fairly seamless, and they don't have to go to multiple different sources to report the information. Most of the information actually was already in there because they entered it previously. So we're leveraging something that they've done before, and we're making sure that it's addressing another use case.
Right.
And now we just have to make sure that we can get all the plans and markets sort of buy into this broader strategy and also be responsive to these updates as these providers are making them in these workflows.
Yeah. It's like we have the channel open. The heavy work has been educating, aligning with the provider community to get the results that we want, right?
Right.
Yeah.
And it's also closing some of those other channels so that there's, again, one place where a provider or practice manager or office manager can go and say, yep, I've updated my directory information here, and it's correct. And I can't tell you the number of times I've talked to so many people at these user conferences that we have with our provider community, where it's that, I know that my health plan is using CAQH ProView. I'm reporting my directory information in CAQH ProView. Why can't they use that? It's the most up-to-date, it's the most accurate. I make sure to attest one every 90 to 120 days, and I don't know why they keep on calling.
We get a few of those emails every day at our help desk. Yep. So the question here is, what tactic will you add or improve to assist in overcoming your provider data challenges? So you have had some discussion today about what the provider's perspective is, and different things that health plans are trying. Just wanted to get your sense of of these kind of 5 items here. Which ones are you going to look at and consider for future work? So hosting provider education sessions to align on definitions of accuracy and the importance of it. Provider outreach, number 2. Number 3, economic incentives, as Hassan talked about. Number 4 is existing workflows, leveraging existing workflows to capture these updates. And number 5, your process is working well, so you don't have to make any changes. So would love to see what your responses are there. We'll keep it open for maybe 5-10 seconds just to get everybody's responses.
As we're getting some responses to our polls, I see we have one question, and it's more targeted towards our solution, but we can talk about that. So the question is the information in our solution self-reported? How do you know the information is accurate? How do we know they're updating the information with you regularly? So there's several layers to this question. Let's talk about how do we know they're updating the information regularly? That's the most straightforward. And I can talk a little bit about how we can qualify how useful that information is.
Okay. You want me to?
Yeah, we can talk about our attestation rate.
So in terms of the regularity, we have a 120-day attestation cycle where we require the providers to come in on that frequent basis to be able to review and update and attest to their information. If they don't do that in that timely fashion, then the information actually becomes expired and unavailable to help them. So they have very incentive, and most of these guys come in here on a regular basis, don't require reminders, but we do the reminders just in case so that we can make sure that they're prompted to do that. In terms of the accuracy, did you want to address that?
Yeah, so I think, accuracy is an interesting problem to solve, right? So there's this idea that there's absolute accuracy in the market.
Right.
And I think what we need to do is move more towards how do we take the data that exists today in the market, which is 50% accuracy more broadly across the industry, and move it further along so that we reach that point where the data is 90+% accurate.
Right.
So one of the things we're doing with our direct-to-show solution is that we recently started to do is we're taking health plan data and we're comparing it with the information that the provider has self-reported in ProView.
That's right. Yeah.
And especially with practice locations, which are the key directory errors, we are asking the provider to comment on the differences where the health plan has a location listed in their directory, but the provider did not report it in ProView.
Yeah.
And we're using these strategies to get the provider involved due to our strong provider engagement to help drive that accuracy forward. We've seen some really positive results with some of our early adopters, and we hope to use this approach and continue it in the industry. I think what we've found out is that our solution can be scalable, repeatable, and can definitely produce significant accuracy gains.
Yeah, Son, looks like there's some interest in that topic, so we'll probably explore that more in an upcoming midday download. In terms of the tactics that you guys are most interested in, it looks like it's pretty split between number 2, 3, and 4. Number 4, using existing workflows to import updates in directory data. That seems like the leading one that you guys are interested in considering. That's good. We want to make sure that the providers can provide you accurate updates as quickly as possible. Actually, that's really interesting that there's so much interest in the incentives. Well, maybe we can explore that as another topic, as we get some more results from some of our plans that we're working with there. And then deploying outreach to confirm information on file. That's always going to be part of the equation. It's just kind of striking the right balance between, outreach and using existing workflows. A lot of plans are doing, sample audits of their data. So, that level of outreach seems pretty reasonable. Yeah,
I think I wanted to comment on the strategy to use outreach. I think we want to talk about it in one of our upcoming upcoming midday downloads. But, I think we have to caution the industry here. We know why folks are doing it. There's sort of this need to get data right immediately.
Right.
But in the long run, it is burdening the provider community. And if we need to do it, we have to be very strategic where we apply these resources.
Yeah, that well is going to go dry at some point.
Yeah.
So
we're already starting to see a lot of pushback.
Yeah. Okay. All right. Well, thank you for responding to the poll. Thank you for joining us for this midday download. We're going to have more of these coming up. We'll be releasing new topics, so encourage you to keep an eye out for those. You've got our information here. If you've got any follow-up questions, we're happy to answer them. If you're interested in learning more about any of the topics that we've discussed, feel free to visit our website, which you see here. So we are very interested in looking forward to speaking with you guys again.
Yep, and I also want to chime in, if you're more interested to learn about our current solution offerings, please do feel free to reach out to our sales team. Some of you may already be in contact with them, and they can give you more information about the mechanics of the solution and how it resolves some of these problems that we talked about today.
Okay, have a great day.